I'm going to hopefully shed some light on why it is that you can't get answers in the medical system, why it is you feel like your body's failing you, which, surprise, it's not. There's always reasons why your symptoms are happening to you and happening for you. Really, they're happening for you as much as they seem like a pain in the butt. So I'm not here today to talk to you about eating more protein, strength training, and walking and eating fiber and drinking water. That is not worth your time because there are 1,001 influencers and people telling you to do that. And I am going to bring you a fresh new perspective you probably haven't heard, and it will hopefully inspire you to understand why your symptoms are happening for you. So I want to tell you a bit about me. So you're like, yeah, okay, girl, sure, enlighten me. I'm going to tell you why I have the experience to speak to what I'm going to say today. I've been a registered nurse, born and raised in Alberta here in Calgary, and I went to U of C, graduated 18 or so years ago as a nurse. And I thought that that was healing. I thought I am going to save people. Like, look at me. I'm going to live this amazing life. Even though I grew up in a very rough household with an alcoholic father, and a lot of nurses that go through that kind of situation end up wanting to help and they want to make a difference in the world. And I think that's what led me to feeling like I have to do an important thing in this world. I have to be there for people. I have to make a difference and an impact. So I went into nursing, and even in nursing school, being like a chipper, 18-year-old, I was like, something is not right here. Because what I saw was mostly that women and everybody, so we're speaking to women today, but women, men, children, they were being given prescriptions to kind of quell symptoms or squash them down. They weren't really given full explanations for why the pain, why the inflammation, why the headaches, why the digestive issues, why the anxiety, the acne, the eczema. There was never solutions. And I started grappling with this in my heart. And I was like, I don't know that this is really health. And I knew this even 20 years ago. So I talked to my then husband, then boyfriend, now husband, and I said, I'm not sure I can finish this degree. Like it's feeling so misaligned with what I believe the body is capable of. And he was like, well, whatever you want to do, but finish it. And then maybe you can find a job in nursing that fits what feels good to you, maybe more nutrition or prevention. So that's what I did. I was like, okay, I'm going to do that. So I graduated, went into emergency medicine. So I worked in the ER for 3 years. And that was somewhat, gratifying because, people would come in with a broken bone and cast it and send them away. And that was the kind of work that was like, okay, I can do this. We're helping people. But it was the ones that we couldn't really help, like the woman coming in with, you know, severe pelvic pain. And we would do a pelvic exam there in ER. And she would leave with pain medications and be told, follow up with her doctor. The people coming in with recurrent aches, pains, digestive problems, going to the bathroom 10, 20 times a day, even having blood in their stool, and really not getting answers. And that again was like that poke of the universe saying, this is not the place where we're going to help these people. So I went into cancer care and I'm like, okay, now I'm really going to help people. I'm going to give them cancer treatment. Only I saw that cancer patients back then, before COVID, of course, this was a long time ago, they were given literally home baking from these sweet grandmas that would volunteer, and they would push around a cart with like shortbread cookies and like butter tarts and tea with white sugar. And as we were decimating every single cell in this person's body and hoping their immune system would rebuild, we were giving them refined flour and sugar. And I just couldn't do it. I thought I cannot be part of this environment because I know there's a better way. Why are we not giving them XYZ number of things that could help? So the lack of conversation about root cause, which I didn't know that term 20 years ago, but I knew we weren't getting to the bottom of it.
Mhm.
And the lack of comprehensive care, like are we talking about their lifestyle, their nutrition, their blood sugar, their stress levels, their environment, their history, their childhood, their trauma, their nervous system? Like none of that was even up for a second of conversation, none of it. And if you even attempted to do that as a nurse, so if I said, with your heart problems, if you ate more like that, then they would be like, oh, the doctor said it was fine that I eat what I want. That was literally what patients would say. And so I thought, okay, here we have absolutely zero impact. And I'm not going to be a robot and push prescriptions. It's for some people, but it's not for me. I'm not put on this planet to do that. I think that's because I'm a Gemini and I was like, I ain't gonna do that. I am gonna do what I want to do and help people the way I want to help. So that's a bit of my starting journey as a nurse. And then I stumbled upon a company in preventative health, and it's not around anymore, but it was a catalyst to help me understand all the things that were missing. And within that company, I was able to do a whole bunch of cool tests on myself and get even healthier. So here I was thriving and being like, well, I'm glad I'm not in that broken system. But then after I had my second child in 2015, so 11 years ago now, I fell apart and I had the symptoms. I was like, oh, I'm bloated. I have eczema, cracking and bleeding on my fingers. I have TMJ. I have headaches. I got PMS. I was even starting to get anxiety, and I've never had mental health issues. And so I went to my doctor, just like all of you have done probably numerous times. And I was like, okay, something's not right here. My hands are cracking and bleeding. I'm getting recurrent sinus infections, having to take antibiotics, getting things like BV and migraines and all these things. And really, she actually said, like, you look perfect. I look the same as I do now. So it's like, well, you look fine to me. So I think it's okay. You just have two kids under, under the age of 3. So I that was another big poke from the universe, being like, you're right, Ninu, you were right. You're not going to get the answers here. So that led me on a path of searching and digging and not giving up until I found those answers. And I am the hugest fan on planet Earth of you also treating your body with such reverence that you do not accept no answer. You do not accept a half answer, or that meds are the only way, or that you're stuck with it, or that it's your genetics. Those are all stories, and they're stories to explain away the fact that they can't get to the root cause. So I refuse to live that way for me. And I want you to have the same love and trust for your body that you also refuse. That you're like, nah, nah, nah. This is my one and only shot here. This is my one rodeo. I ain't gonna miss it. I'm not gonna miss out on the kids' soccer games. I'm not gonna miss the travel. I'm not gonna miss the camping, the bike rides, the hikes, the adventures, the Zumba, the yoga, the whatever, the travel when you're going to Italy when you're 65. Most 65-year-olds cannot walk that far. They're on medications and they're in fear of their frailty. So we're waiting for a time to come, but if we don't have the health now, you certainly will not have it later. I can say that with 100% certainty. So working on your health now, whether you are in your 30s, 40s, 50s, 60s, it the best time was yesterday, the next best time is right now. So when I started digging for answers for myself, I found the world of functional medicine and integrative health. That was a zero conversation piece in Canada, zero. And this is maybe 7, 8, 9 years ago. And I was like, oh, this is interesting. They're looking at the body as interconnected, that my skin could be related to my gut,
Hmm.
that my anxiety is related to my gut microbiome, that all of these issues I'm having are actually interconnected. And that was the first time I'd ever really had that thought. So I ended up doing all this trial and error, guinea pigging myself, being the N of one in the study of being like, I'm going to test everything for me. All these private pay, out of pocket, not covered in the sick care system
Hmm.
to on myself. And guess what? I finally got the answers. And I'm going to share more about those tests later. But I did those tests on myself and I figured out I had a million and one root causes. Not really a million and one, but I had answers. And those root causes were behind all my symptoms. When I eradicated them in the right order, it's like I removed the barriers on the road that were actually creating a block in my health. So I removed the barriers from the road and I was able to summit the Everest of health. And ever since then, I'm in my 40s. I'm 43 in a couple weeks. And I can say you can live symptom free. You can live without symptoms. You can live without anxiety, brain fog, joint pain, autoimmunity, IBS, skin problems, depression, insomnia. It doesn't matter how long you've had it, it just means that the road might be longer. So when I did these tests on myself and understood my root causes, I was like, Eureka, this is amazing. And I made the changes and I understood where I was blocking myself with my lifestyle choices and nutrition and environment, and where there was things physically in my body that was creating those symptoms. So when I was able to put the two and two together, create a new foundation of health, plus test and figure out what the heck is actually causing and contributing to these symptoms, The symptoms went away. And the central piece to all of the symptoms that you're probably missing is in your gut microbiome. Your gut is so incredibly powerful. And you might think, no, 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 girl, it's hormones for me. I'm in perimenopause. So what are you talking about? The perimenopause is why I'm anxious. The perimenopause is why I have brain fog. The perimenopause is why I have sleep issues and fatigue and cravings because you're being told that there's a list of 100 symptoms. So, of course, it could be a contributor. But I'm going to tell you that your hormones are a report card on everything else over here. Everything else over here is your gut microbiome and your gut health, your liver function and your bile function, your blood sugar level, your circadian rhythm, your lifestyle, your nervous system and adrenal function, and your minerals. So all these things add up like an equation. So we can summarize them all equals hormones. The hormones are over here and they're going to respond to the inputs of these other factors. But everyone's thinking, well, if I just replace my symptoms, if I or my hormones, if I just find the doctor who will give me the bioidentical hormones, it will change everything. I'm going to tell you, it's going to change a few things. You might not have hot flashes. You might not have as much brain fog. You might feel less anxious. You might sleep better, but it's giving you the hormones, and the hormones still need to be processed in a body that was relying on your gut, on your liver, on your blood sugar, on your environment to keep those hormones healthy. So if you have experience trying hormones and you're like, I felt good for a while, but yeah, I can't drop the weight. Yeah, I am still irritable as ever. Yeah, I
Mhm.
still do have a lot of belly fat. Yeah, I still wake up just less than before. Yeah, I still do crave sugar, but like I don't have those hot flashes. That's because it's an incomplete solution to just do the hormones, right, Jessica?
Yeah, so
So,
I hear that a lot, like with my clients, where they're just like, I found someone and it was good, and it either really tipped them over into feeling much better, and then at a certain point just doesn't work as well, or it clears up some of the issues but not others, and then they spend, sometimes years kind of trying to find a different practitioner and trying to find a different prescriber and going this way and that way and this and the delivery system and all of those things. I'm not discounting any of that and saying don't do that. I personally have had a lot of benefits from prescriptions, but I also agree that our healthcare system is not meant, it's just not designed to look at it from a root cause position. It's meant design, okay, your arm isn't working. What's going on with your arm? And they never really think about what's going on with the back that could be contributing to what's going on. They're not looking at it from that holistic standpoint of what's happening. And I've seen that a lot. And what you're saying right now makes sense and could be partially why I found when I started working with Mary Claire Haver wrote the Galveston diet.
mhm.
And some of her recommendations were like, cut out that added sugar and see what happens. Cut out those things that are irritating your gut and working with trying to, I mean, she didn't say let's do a liver cleanse, but I know from my background, looking at what she was doing is like, okay, that's really what we're doing here is trying to clear out like maybe this idea of, I hear this quite a bit that there's like a toxic load at a certain point in your life where you've just had everything's been going along okay. And then it's tipping point now it's not quite working the same way as it has before. So it's really about optimizing your overall health and well-being. And it doesn't mean that you look at healing the gut and then you would just turf all of your prescriptions. That's not what we're saying at all, right? Definitely don't stop taking any of your prescriptions without talking to your doctor ever, to everybody. That's I see that causing problems all the time where I had
Oh,
one client be like, wow, I feel so much better because I'm doing this practice with you. Everything's going great. So she stopped taking all of her antidepressants without talking to me or her doctor. And then within months was bedridden and horribly depressed and had no idea what had gone wrong until she finally went back to her doctor and they went through her file and went, oh, right here, you're actually really you're going to need to be on this for the rest of your life. You're one of those people that really isn't going to be able to just feel better and go off of it. But that's one of the dangers of just dumping your prescription. So
yeah, no, no one's ever advocating for dumping prescriptions.
yeah.
It's about trying to understand why your body is requiring that. So when it comes to the example of mood, so a benzodiazepine. So most people think anxiety is a mental health issue. Now, if you had significant trauma and you're like, I know why, because I had XYZ terrible, awful thing happen to me, of course the nervous system is going to be more apt to protect you, and that comes across as anxiety. So there are reasons that things happen in your head, but the very important missing piece is that the gut microbiome makes 90% of your serotonin, 50% of your GABA, and 50% of your dopamine. So your motivation, your drive, your calm, and your happiness are coming from the microbes in your gut being healthy, and they signal cells in your gut to make those neurotransmitters for you. Those neurotransmitters are delivered across cells in the body that then can work on through the vagus nerve and affect the brain. But when you go to the conventional medical system, because they don't see the gut connection to the brain or brain function or mood or cognition for that matter, they will give you what works on the brain. So a
Hmm.
benzodiazepine, we're working up here. So you never go cold turkey. You don't go, well, I'm gonna work on my gut, so I'm gonna cut it. You're gonna do it. There's a bridge. You cross the bridge and you start working on the pieces that are impacting your overall health. And then you have the conversation. So I work with women over 6 months. This is not like a see you once and we're just gonna fix everything. It's a
Yeah,
six
yeah.
journey shifting all the other factors that create health. And then I never tell anyone to go off their medication. They themselves go to their doctor and go, I think I don't need this anymore. I'm going to cut my blood pressure medication in half. I'm going to know,
Yeah.
doctor, what do you think about this? Da, da, da. And it's that doctor-patient relationship regarding drugs still has to be there. But
Yeah.
it's that you did the work to find the root causes and allow your body to come into true homeostasis first so that the body doesn't require outside intervention long term if that's your goal. So
Hmm.
definitely, I haven't had that experience in all the years I've been working one-to-one with clients. So, but I do see them over 6 months and develop a very in-depth relationship, and they know that we're working on these things. We're not turfing everything and throwing the baby out with the bathwater and trying to do this other thing. That's not the way it is. The body is interconnected, and it's about the fact that the medical system is not looking for root causes, but it's not seeing the connection. So the number of times I've seen women be diagnosed with IBS and have anxiety or have that's not the way it is. The body is interconnected, and it's about the fact that the medical system is not looking for root causes, but it's not seeing the connection. I
So
just heard a
the number.
playback of myself. Why is that? Can you hear that?
Hmm.
Did you hear that playback, Jessica?
Yeah, sorry. I'm just trying to check to see if there's any live chats and it just automatically does the but it's muted now. So if people wanted to chime in and say something, they can and I can see it because that's kind of
Perfect.
nice to do the live. But no, I agree with that completely because I've had that experience when my thyroid spontaneously, started doing its job again and I didn't need the medication anymore. But I didn't just decide to stop taking it. I went back to the doctor. I have a functional medicine doctor. So she does look at everything holistically. And she was like, oh, I guess your thyroid kind of figured out what it's supposed to be doing and started doing it again. And now you have enough. So you don't need that desiccated thyroid anymore. Like the
Mhm.
body is just capable of a lot more healing than our standard prescriptive kind of like let's just shut down that process or change how this is working in a real quick fashion and without really looking into what that root cause is, you might really be missing like optimizing your health. Also,
Yeah, and truly, the average health out there is really dismal. Most people have symptoms. Most people, many adults are on prescriptions. Many adults, and I'm not when I say prescriptions, I don't mean bioidentical hormones. I'm talking about prescriptions to lower inflammation, lower blood sugar, lower blood pressure, control things like PCOS. So I'm talking about prescriptive things, and even though bioidenticals are a prescription, though that's not what I'm talking about when I'm saying prescriptions necessarily. I'm talking about medications and pharmaceutical drugs that are working on quelling symptoms. They're not address the root cause. They're going to decrease the inflammation that causes the migraine. They're going to decrease the blood pressure at the heart level so that your numbers look right on paper. But the mechanism of how those things are still playing out is there. It's like the fire is is we've kind of like put limits on the fire, but it's still burning. And that's where the scariness comes. So being a nurse for 18 years, working in a whole bunch of different places, and being certified as integrative health and functional medicine and nutrition and blah, 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 and all these things, I can tell you that the medical system is not going to, that giving you the drugs is not going to replace the need to do the work.
Yeah.
So now with the even like the Ozempic, it's like you might look different on the scale and the number might be different and you might feel different in your body because you fit a different clothing size. But the mechanism that brought the weight on, if you don't change in conjunction with taking it, if you don't change how you got there, you're still on the same path, just in a different physical body. So there's big statistics on this that people go off of Ozempic. I think it's like 60 to 70% will regain the weight within a year of being off of it.
Yeah, which makes
Like,
me so sad because, the I'm not saying don't try different things. And if you wanted to try that, I wouldn't be, saying that you shouldn't. But when I first looked at it, I was like, you know what? If this thing was developed to control diabetes, right? Adult onset diabetes, that was what that drug was targeted for. What happens if you take it when you don't have adult onset diabetes, but then you do develop it and now you've been taking something for something that you don't have, but now you do have, and now you need even more. It just seems like you potentially creating like a long-term pain situation. Maybe you're getting a short-term gain, and everybody's situation is different. But like one of the friends that I know right now ended up getting all the results that they wanted for sure, and is throwing up every day.
yeah, I had a client like that too. She was on it for a year, didn't actually lose weight, came
Oh,
off of it, and she threw up every single day for a year. And sometimes she'd go to the ER because she would throw up so much in a given day that she was dehydrated. She came into my program. She has never thrown up again. And she lost weight. And she's like, I can't believe that I even considered the other way. Because what's happening with the weight loss is muscle loss,
yeah.
number one. So we're not prioritizing that we're losing fat. We're becoming a smaller version of ourselves. But when you lose muscle, your bone density will be impacted. And we know that women are at huge risk of bone break, especially with the loss of estrogen after the age of 65. So you're losing your estrogen, you've dropped the weight in whatever fashion that a drug can do, which is to drop the muscle as well, because that's more expensive to your body to maintain. It goes first.
Mhm.
Then you end up more frail and in the same metabolic condition state if you don't change everything else in the interim. So basically, there's two doors, and the door can say, both say hard on them. So you choose your hard. Do you go
Yeah.
through the hard door where you do the work, you make the changes, you make it sustainable to your lifestyle, your nutrition, your environment, your choices, and you invest in things like functional testing to get to the bottom of the root cause? Or the hard door that says, I'm just going to do the prescriptions. But that's a very hard life too, because that's the life most people choose. And so I'm not here to try to speak to everybody and say, everybody wants what I offer, but I'm here to say that if you don't want to be average, if you don't want to be on medications and frail and succumbing to entirely preventable conditions, which are the majority of what Canadians die from, like cancer, heart disease, and stroke, and diabetes, those four conditions are all completely within your control. And we're not really given
They all
that.
related to inflammation too, like.
Well, they are because all those conditions are metabolically driven.
Mm.
And when the metabolic function is erratic, that in and of itself is inflammatory. So we hear all these words like throwing around about inflammation, but our body's always adapting for survival. And if there's inflammation, then we have to figure out what is causing it. So we can't just blame it. Oh, it's just inflamed.
Mhm.
Perimenopause is an inflammatory time with the hormone kind of ups and
Yeah.
downs. But we can't just label it. And we
Mhm.
live in a world where if we label it, we think that means something, but it literally means nothing. So
Yeah.
perimenopause inflaming you is true, but it changes nothing other than still doing the work and going through the door, the hard door of making the lifelong changes, or the easy now, very hard later door of the chronic conditions that most people die from because they don't want to do the work. And so the way it is, most people, Jessica, don't want to do the work. They're
Yeah.
more like, I just want to carry on with my same lifestyle and be undernourished, stressed, have unstable blood sugar, be nutrient depleted at the cellular level, have unresolved gut dysfunction from the time I was a kid or 20s, 30s, and just ignore it. I always pooped twice a week. I always had loose stools. I have IBS. Writing all that off is the biggest danger you have to yourself. Writing off that lifestyle and then saying, well, this thing over here takes away a lot of it. It doesn't really. The mechanisms of these things are still happening. It's just that you're going to see the change so slowly and the decline is long So you're on the
Yeah.
decline path, but you don't know until, and the older you are, the faster the decline is. So if you're 35, it's very easy to ignore painful periods, migraines, moodiness, at your husband, irritability, and the odd sinus infection and UTI. It's like, well, that's just an inconvenience in my life. But if we don't change the way you're operating in your 20s and 30s, and I always say the 30s is the best time to take care of yourself and invest in yourself. If you can learn the types of things I teach in your 30s and you maintain that same lifestyle in your 40s, 50s, 60s and beyond, you can largely mitigate a lot of the risks that are coming down the road because you're not even on that path. You're not on the path of blood sugar instability, gut dysbiosis, mineral deficiency, nervous system disruption, and all those things are going to impact how smooth your perimenopause journey is. So perimenopause is a revealing state.
Oh, yeah.
It's revealing how the journey you were on in your 20s and 30s is leading you to the door of perimenopause and how smooth that gauntlet is. When you open that perimenopause door, you're going through the gauntlet. You're jumping over crocodiles, you're hanging on the thing, you're swinging over to the wheelie thingy that you have to land on. All of the difficulties, that gauntlet is much easier to navigate. And that means, AKA, less symptoms for you when you work on the things that actually impact the hormones.
Yeah, I see that. Like when you're talking, it just made me think this is one of the things that I see with people that I work with. Because if they don't want to deal with lifestyle stuff, I'm not going to force them to do anything. But the ones that really get the biggest bang and the best results are the people that really actually look at that. Okay, so what is going on with my sleep hygiene? What is that? How can I maybe incorporate some simple things that will help me to sleep better? And what's going on with my, vitamin regime and what kind of stuff am I just doing out of a habit where I'm not even really thinking about it? Like, am I choking down my goldfish with a glass of wine every night because I'm stressed out and I need that stress relief, but I don't really know what else I could do to help myself to calm down, which is where all the yoga therapy comes in. And that's largely my background. But because I had my own inflammation condition, I'm super excited to meet you too, because I've done, you name it, I've tried it, but I haven't really, I mean, I've done things that are supportive of gut health, but I've never really looked into like actually what is going on with my gut very thoroughly, other than, to recognize that it does impact my overall health and well-being. And I think that when you can get those things in line, right? How are you relieving your stress? How are you, moving the body? How are you having your nutrition and how is your gut functioning? Then when you add in some bioidentical hormones or different prescriptions, they're going to work really, really well because you're in this optimum state, right?
Totally. Yeah,
Yeah.
I just had a client this morning that she's got a lot of complex issues, and if she was in optimal health right now, then it would be a great time to consider bioidenticals. But I said to her, she asked me about it, and I said no, because what we're doing is putting more fuel on a fire because you already have a lot of symptoms in a billion other places that we need to address first. We need to be in a state where our body's like, ooh, this is exactly what I need right now. Not saying, oh, there's a dumpster fire and we're going to just hope that this other thing is like the fix. And if it has resolved some of your symptoms and you're like, my brain fog went away overnight, that's amazing. That means maybe you were in a better state. Your door you opened, the gauntlet for you wasn't as much of an issue because you took better care of yourself in your 20s and 30s. And it's not to shame anyone that, like, shame on you, you didn't take good care of yourself in your 30s, because your 30s is a very busy time of life. Usually you have children, most women have children, they buy a house, they're trying to build up their career, then maybe their babies are not babies anymore, so they did stay home but now they're not, so they're back in the workforce, and then the hormones start changing postpartum, and then they're like, okay, but like I had to prioritize taking care of my kids for the first 10 years when they, or 8 years when they really needed me. And so I kind of put myself on the back burner. But then this dragon comes along that could be a dragon for some people, perimenopause. And they're like, okay, so now I'm getting punished that I couldn't take care of myself in my 30s because I was so busy taking care of my children and my family. Kind of. So it's very important that during the 30s, especially if you are in your 30s, this is the time because it doesn't get easier. If you wait, the longer you wait, the more deeply rooted things like gut dysbiosis, so candida, fungal infections, parasites, bad bacteria, low stomach acid, the longer those things are left lingering in your gut microbiome, they destroy the gut wall, they trigger the immune system, and bad bacteria create something called LPS. Lipopolysaccharides are an endotoxin produced within your body. They go outside of your gut, and guess where they go to? Your brain. And they cause brain fog. They cause
Mhm.
joint pain. They cause thyroid problems. So the single biggest driver of inflammation that women are just thinking, yeah, gut health's just about pooping. And I do that just fine. It's not actually about pooping. So I told you about the piece with the brain, 80% serotonin, or even 90, 50% dopamine and GABA made there. But also, so that's the brain piece. Also, 20% of your thyroid conversion of T4 to T3. So putting gas into the cars of your thyroid cells happens in your gut. So
Mhm.
if who would like a 20% increased metabolism? Not sure about you, but most people want.
Yeah, yeah.
But if you're constantly have the brakes on the system, because that portion of the conversion doesn't happen because your gut's a mess, that you're bloated, you're gassy, you have heartburn, you have food sensitivities, and if you just avoid 14 foods, you feel good. That is not health. You shouldn't need to eat a restrictive diet to not have symptoms because we evolved as human beings. I'm certified in ancestral health too, so I always think I bring everything back to our biology from long-term ancestral trend. And we were adapted and we could eat like now there's maybe four types of tomatoes in the grocery store. There's
Hmm.
actually like 100 in the world. Like there's so many varieties of all kinds of foods of rice. I bet you there's 100 and we can get maybe six or
Or
eight different types,
yeah.
four in the store.
Yeah.
So we should be able to eat a wide variety of foods without digestive recourse. But the reason why we have digestive recourse is because we live an inflammatory modern lifestyle. We stay
Oh yeah.
inside all day, we drink alcohol, we vape, we smoke, we over caffeinate, we undereat fiber and protein, we overeat refined grains that are sprayed with glyphosate, which is a direct gut disruptor. We do chronic cardio, we restrict, we ignore our past traumas and what happened to us, which still has an impact on your body and is still contributing, especially if you have autoimmune disease. Very, very, very important component is the nervous system and trauma. So when we have all of this modern lifestyle kind of stuff coming at us, and we just think this is just how life is, and we don't start to flip the lens and go, wait a minute, I'm living in a fight or flight state. My stomach is deprioritized, my gut microbiome is decimated, my all my blood flow is going to my muscles, which is why I'm sore as hell all the time and achy and have a tight neck and headaches and joint aches and muscle aches. That's a pretty good sign, and heart palpitations
Hmm.
or everything's all up in here. That's because your body is perceiving your lifestyle as stress. Even if you sit down with a psychologist and they say, do you feel very stressed? And you say, no, I'm fine. I have my coffee. I had a good sleep last night. Like, I'm not stressed. That's what I used to think was stress was. But what I teach in my program is that's not stress. Stress is a million and one other things that you're doing every day that you have no idea about. It's waking up at 5 a.m. to go to F45. If you're doing that and you're trying to hit your macros, that's stress. If you are restricting, you're counting every morsel of your food, that's stress. If you are sedentary and you stay inside all day, you don't see the light of day except maybe you walk your dog like for 30 minutes, that's stress. If you're constantly looking at screens and scrolling and taking in the news and social media, that's stress. So modern day stress looks very different than past ancestral stress, which was meant to be very short term and we recover. We run from the bear maybe every other day, once a week even, and then we recover. We're mostly we're mostly procreating, eating, laughing, present, and joyful. That is how we were evolved. So the life then, which they had, obviously no clothing, no heat, no luxury modern conveniences and air conditioning and cars but their life was actually less stressful than ours today. So it's starting to understand that if you want to have true optimum health, instead of trying to grab the next supplement off of TikTok or this recipe or that thing or this thing or that thing, it's about rebuilding a foundation of your health that teaches you how do you lower stress. So seeing somebody like Jessica, it's like, okay, that's going to help me lower that nervous system fight or flight.
Oh
But what
yeah.
about the other pieces? What about the gut microbiome? What about liver function? What about your environment? Are we using toxic products in your home? Do your cleaning products have poison symbols on them? Are we putting toxic makeup with lead and contaminants on your face every day? Are we overeating caffeine, eating, I mean, I love iced coffee, don't get me wrong. Like I could probably have three iced coffees a day. So are we fueling on iced coffee and protein bars? Are you drinking wine to deal with how crappy you feel that you're busting your butt in the gym and you're doing all the right things and you're not seeing changes? I just had a client last week, but she wrote me an email yesterday. So she came into my program and she's like, her words were, I just want to feel joyful again. I want to
Mhm.
feel like myself. She'd gained 30 pounds in 2 or 3 years, changing nothing,
I hear that.
still walking her dog and eating clean. So she had a whole list of stuff she wasn't eating. So I said, okay, yep, let's do this. So in my program, I'm going to tell you why this matters. In the first module where I teach about blood sugar and lowering inflammation through food, I have two paths you can take. You can choose to follow the meal plans that I've designed for you, or you can just follow kind of the strategy of what we're doing. So when I met with her for her one-to-one visit, she had done module one and she had been in module two, which is the nervous system. And she said, "Yeah, I don't know, my energy hasn't increased and I haven't really seen any loss of inflammation." And I said, "Oh, that's really unusual because I expect much better benefit in my client work." I said, "Okay, tell me exactly again, what are you eating? What are you doing? How are you moving?" She's like, "Well, I already wasn't eating the things that you mentioned. I already had recipes that I liked, so I was just doing those." And so she told me what she was doing, and I was like, "Girl," and I could pull out some things that were causing issues. And she's kind of like a type A student. So she was like, "I want to do what you say." And I said, "The meal plans are not like generic, like, hey, just go have this cup of cottage cheese and like meet your protein goals." I said, "The meal plans are strategically designed to soothe your GI system, stabilize your blood sugar, and lower inflammation all at the same time." So she's like, "Oh, there's actually like reasoning for the food?" I said, "Yes, every single recipe is strategically designed." She goes, "I had no idea." So I said, "Okay, how about we do this?" She's like, "I'm happy to follow it." So I said, "Go and pick there's meal plans that graduate, so they broaden it out. So we're working on gut healing and we broaden variety over time." So she did week one and she wrote me an email yesterday. And so she said, "Oh my goodness." She said, "I have lost 4 pounds in a week." She's like, "I have no more cravings. I'm sleeping better. My skin looks better." She's like, I cannot even believe that, like, this whole time, all these years, just trying to struggle alone, eating clean, walking her dog, exercising the throes of perimenopause. And I was able to the benefit of working with somebody that's been doing this for 20 years is I can literally in the background I'm like masterminding
Mhm.
exactly the steps you need to take. You almost don't even know all the depth of what's behind the scenes
Oh,
of
yeah.
the plan, but the plan is working for you on multiple levels. So she's just like blown away. She's just like and not everyone has to follow that in the beginning because the first 30 days we use food as medicine. But the recipes are strategically designed. So I say to people, you don't have to use it, but you use the recipes, but you don't have to follow it verbatim or bring in your own that meet this criteria. And so what she was doing was totally counter, even though it met the rules, it met the food rules. So it's not about food rules. It's about what's that food telling your body. And so that's the first kind of step in the program is lowering inflammation so the body can start to be humming along the right path. But that's where I think the food goes wrong with people. They do things like carnivore, or they're so desperate for change that they implement really harsh strategies that are not sustainable.
Mhm.
I
Yeah.
have GI results of the microbiome of someone who did Ozempic, somebody who did carnivore, and I can tell you that their beneficial microbes are decimated. They're so deficient, they're in the red zone. And
Mhm.
the reason why that matters is because those guys, guess what they create? Anti-inflammatory compounds called butyrate, propionate, acetate. So they're fighting inflammation for you and making those neurotransmitters. They synthesize your B vitamins, your vitamin K. They help with that thyroid conversion. They get rid of your estrogens for you after your body's used it and is done with it. So if you're not pooping, you got an estrogen problem, 99.9%. So when you can have your gut microbiome working for you, the benefits are limitless. And that's where when I did was in my healing journey, I was like when I wasn't bloated anymore and I worked on all the steps that we've been talking about, I didn't have a sinus infection ever again. I never had a headache again. I never had a joint pain or anxiety or acne or eczema. So I didn't have to target the eczema. I didn't have to say, okay, I'm going to put topical steroid on there. And then I'm going to take antibiotics for the sinus infection and take naproxen for the migraine. I'm going to cut all the foods out for my gut. But that's what women are doing.
Yeah, yeah.
They're like targeting these hyper specific areas instead of looking at themselves as one beautiful self-healing organism that they are.
Mhm. Yeah, and I also see like from what you're saying, and I see this a lot with people where it's like, just tell me what to do, and then they assume it's going to be really hard, and the harder the better. And so they'll pick something like I have one friend who's kind of addicted, I think, to ketosis, where she's
Okay.
always trying to get into ketosis and basically starving herself. And then when she does eat, she overeats, and so the weight is fluctuating or it's not doing what she wants it to do. But anytime I make any suggestion about, maybe you need a more gentle approach, maybe you need something, maybe your body actually finds that stressful that you're, not, and I like intermittent fasting. I do a little bit of that, but I try and do it in a way that's really very gentle. So it's not always the same and it's not really long periods of time. And if I'm hungry, I'm going to eat something. I'm going to try and pick something that's, high protein and fiber because that seems to work for me. But we have that idea that if it's going to be good, it has to either be expensive or hard or difficult. And I think that those ideas work against us when we need to find something that is what I like about the yoga, the way that I teach it. It can be 10 minutes. It doesn't have to be like a big, huge thing. And it doesn't, I have the balls and I have the equipment and I like to do stuff, but it doesn't have to be overly complicated, and simple can be, especially if you're talking about, I think, healing your gut, the more complicated you get, or even like the restrictive diets. Like I've done some of it myself. I did an anti-inflammatory diet for a year
Mhm.
with no added sugar at all, which was really, really hard to do. And I'm not saying that it wasn't worth it to do that because I learned a lot doing that year, but it didn't heal the inflammation problem, you know.
Yeah, because
And
the hidden driver is the gut, and the gut's not always going to change just because we change the food input.
well, the stress
My
around me certainly didn't change, or how I was managing the stress certainly hadn't
Yeah,
changed.
cortisol will break down the gut wall and change your microbes. Lack of sleep will, alcohol will, pesticides will. So people, what I always say is that women are taught to be fixated on food and exercise. And so what I do is everything else, a piece of the food, I don't even touch on exercise. And yet my clients, without calorie macro counting or exercising, literally have lost in 6 months 55 pounds.
But
They're
don't you
like,
see that when they feel better, like you're more likely to be active when you feel better? You're
well,
more
their
likely
life changes. They're like, oh my gosh, I'm going to that hike. I'm doing the bike ride. I'm signed up for the class with my girlfriend. I have one client I could think of just a few weeks ago. When it comes to anxiety, she had severe anxiety. She's medicated for anxiety. She, um, she came to me and she was really mortified, but she's like, I literally poop once or twice a week. And
to.
she's like, I have been that way for 10 years. And she had, no surprise, PMS, anxiety, skin problems, okay, and low energy and cravings. She had such low energy. She doesn't even have kids. So it's not like she's like getting up in the night with a baby or anything. So she had such fatigue, she couldn't even make dinner. And she's in her 30s. And so she heard me speak at an event in person. She was like, yep, instantly. She's like, I have to see what's going on. I want to be told the exact roadmap and steps to take to change my life. She came on my program within a week of implementing what I teach in the first module. She started pooping every day. She has pooped every single day since. And this is after doing magnesium citrate and going to her doctor and doing fiber powder and like all the stuff. She had done it all. So she has been pooping every day. But guess what that did for her? She's like, I can't even believe that my anxiety is so much better. She said to me, she's like, I'm going to go to my doctor and talk about how do I wean off this benzo because
Mhm.
she's like, I'm getting out of the house. I feel social again. And she said that her work, she was always like the anxious, edgy, uptight, stressed one in her group, her business group. And she's like, now I'm the calm one. And I could see it in her second visit when we went over her stool results. She was just so much more in her body. She was so
Mhm.
much more relaxed and regulated and calm. And I said to her, like, do you see that change? She's like, oh yeah, everybody's been noticing. My family, my brother, my best friend. She's like, I feel like the fog lifted from my life. And she's like, I cannot even, she says, it's not thanking me. I'm just the guide to say, here are the micro strategies to implement forever. Not, hey, do this thing, jump on this bandwagon, make your life a living hell,
Hell.
and you better sustain it because you know what, girl? It would have been way easier to create a program like that. To create a program like, let me just type up the most difficult program that is nearly unsustainable and that I probably couldn't do myself. And then when they fail, it'll be like, well, you failed. Too bad. No, no, no. This is about creating things that I literally do every day as a woman in my 40s and a mother and an entrepreneur and a billion other things, having animals and all that. It's how do we create safety in our bodies and health in a modern world today? So the way I work with women is helping them see the why. So I am not about the what. I'm not like, here's what you need to do and take, and this is exercise program, and off you go. I don't do exercise programs, even though I'm certified in fitness. I don't even talk about that. Exercise is so far down the line because in an inflamed body, they're usually overdoing it or underdoing it.
Yeah,
So
yeah, yeah.
it's like we can make tweaks to that and explain why, from your nervous system perspective, you might want to change how you're moving your body. But that's not where the biggest needle mover is. The biggest needle mover is blood sugar stability. It's a healthy gut microbiome. It's sending safety signals to your body every day. It's being connected with the earth, the sun, the light, and your circadian rhythm. It's knowing your minerals at the cellular level. And ladies, looking in your blood, you're like, oh, well, I've done all that and my blood tests are normal. I'm about to shed the hugest bomb dropping on normal lab work, and you've probably never heard it like this. Your blood work, your blood in your body, it is a life-saving fluid. It is the most vital component that keeps your heart beating, keeps you breathing, keeps your brain functioning, and keeps your muscles moving. If your blood work was off, you would have problems in those areas. You'd be in the hospital, probably in the emergency or the ICU, or you'd be chronically ill with multiple systems that are failing, like your liver or your kidneys. So, relying on this fluid that only changes after all the dominoes before it fell, the gut, the organs, the liver, the kidney, the cellular minerals storage, all those dominoes fell before the blood work changes. So if you're waiting for your blood work to shed light on why you feel inflamed, puffy, bloated, brain fog, blah, 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 it's not going to until you're at the level where everything else in the body's compromised. Your blood now shows it. And now your doctor will say, okay, this blood work means you have such and such condition. You have hypothyroid, you have fatty liver, you have RA, you have Hashimoto's, you
Mhm.
have name the thing. And then when that happens, guess what the solution is? Medication to manage the symptoms. It's
Symptoms,
still not
yeah.
going to tell you why you have it. It's still not going to reverse it. And it's still not going to prevent it from getting worse. So, waiting for your blood work is like waiting for the bomb to explode and then trying to clean up the debris. Like
Mhm.
it is absolutely ludicrous that the healthcare system, again, it's a sick care system. Like you said so well, Jessica, it's not designed to look for the root cause. So they're not doing a bad job. They're doing a freaking bang up job. If you get in a car accident, if
Oh
you have
yeah.
a heart attack, a stroke, you need a surgery, and or you are in severe pain and you need drugs now to help bridge the gap till you get to the root, they are incredible, incredible at those things. And it is, thank God we have surgeons and doctors, but their place is in acute care, is in the emergent, the urgent. The chronic symptoms that most women are dealing with, they don't meet that criteria. And then they're waiting in a system that's designed for the bomb to be detonated. Then they'll do something.
Mhm.
When you have the power now inside your body to do something about it. And is it going to be an investment of your time, your energy, and your finances? Yes, it absolutely is. Unless you don't mind waiting for your blood work to change and being given medication to work on the symptom level. But for me, I'm a really big advocate of living your life in the game. I've been a soccer
Mhm.
kid my whole life up to varsity. I still play. And I have two boys. And I would never have allowed myself to be the mom on the sideline, the one that's sitting on the side at the beach and sitting beside the pool, all covered up, feeling bad about myself, feeling puffy and inflamed and low energy, and surfing my phone or drinking the cocktail and being like, I don't have energy to play in the pool. I can't go on the bike ride with you guys. You guys go with dad. I can't do that. I can't do the hike with my knees hurt. Like for me, I'm like, that's life. Your life is just a series of days stacked together and you will look back and remember that. That is what your life is. And for me, I'm like, I'm not going to take this life for granted and be like,
Mhm.
I'll just get healthy later. I'm just going to miss out on all these memories and let my kids grow up. So that was my impetus and my why of why I got myself healthy. and why I really urge women not to give up on themselves. Don't settle if for no answers. And is it going to require that investment outside your comfort zone? Yes, because your comfort zone is designed to keep you on screens all day with notifications, artificial light at night, poor sleep, processed foods, psychological stresses unresolved, chronic digestive problems. Our life is literally built that way. So unless we come outside of that and we go, wait a second, I don't want this life that is further down the line for me if I don't change. And it's being so determined to create health in your body because the fear of where you're going if you don't change it is big enough. And sometimes that's what it takes. A lot of women come to me when they're at rock bottom. They're like,
Yeah.
hey,
Yeah.
I have done it all. I'm done. I'm ready to commit myself. And honestly, when you put skin in the game and it costs you something, you're way more willing to work for it than if somebody gives you a free exercise plan on YouTube.
Yeah, I see that, and I can speak to that from like my personal experience, right? Because I got pericarditis, and the cardiologists were like, we don't know why. Sometimes it happens, and it's important that we caught it before it killed you. That's great, but here's a bunch of anti-inflammatory medications, and you'll just take that for it'll be about 6 months, and then your body will figure out what to do again, and you go off of it, and it should be fine. But I kept going off of it and then getting sick again and going back on the drugs. And then I stabilized and then I'd go off. And I did that for about 9 years of just this round and around and around on these medications. And eventually I got to the point where I was like, hallelujah for the modern medical system. I would have died without it at 37. I wouldn't be here today, but it's just going to keep me alive. It doesn't help to make me well. Wellness is something else that I have to like fully discover myself. And that was partially why I ended up on the yoga journey because my body is a wonderful self-healing machine and I want to give it the opportunity to do that. But
Mhm.
like as you're saying with the level of modern stress, like we're just constantly bombarded with stress. Like my husband and I just recently were like, how can we just get rid of our cell phones? Well, now everything is so complicated. You have to verify who you are through your cell phone to even change a plan on your TELUS account. Do you know what I mean? So it becomes maybe not realistic to turf it entirely, but we did really good and I think we covered a lot, but do you have any final thoughts for us about like I really want women to do this before the thing falls off. Like I wish I
Mhm.
had paid more attention to what my body was telling me before I got really, really sick with pericarditis. Do
Yeah.
you have any final thoughts about that?
I think because your group and the work your guys are putting out there probably speaks a lot to hormones, like I mentioned at the beginning.
Yeah.
But I really want you to take away the message that your body's not broken. It is literally working for you. Every symptom you have is pointing you in the direction of understanding that there's something you need to investigate. You need to take the microscope. You need to work with someone who can break apart what's happening, why is it happening, and get on a different path where it's no longer going to take you down the gauntlet that you don't want to be on. And knowing that your hormones, they don't operate independently. They are not randomly screwed up.
Yeah.
You just get PCOS or PMDD or perimenopause hell. It doesn't come randomly. It responds. Your hormones are a response to inflammation in your life. So whether that's dietary, lifestyle, or environment, stress, whether that's mental, physical, so things like mineral deficiencies, your mineral status, again, looking in blood work, it's the last domino. We can look in the hair and look at cellular mineral structure over a month and a half or the time it took to grow the hair out of the root. And we can start to see patterns that way. And then blood sugar. Blood sugar metabolic health underpins every chronic preventable illness. And understanding that you can be eating for your macros, counting every calorie, and still have messed up blood sugar. Your gut health. Your gut microbes are driving inflammation or they are lowering inflammation. And if you don't know what's going on with your gut and you're guessing if you need an enzyme or a probiotic or a parasite cleanse or da da da, there's a certain order and an art blended with science to be able to shift your microbiome for the long term and help you understand how not to get back to that place. And that's what I specialize in. Sleep. You literally cannot have optimized hormones, gut health, or mood without sleep. It is the kryptonite for women. It's kryptonite.
Mhm.
So thinking that you can sleep from midnight to 7 and you still got 7 hours, it's not good enough. And I share a million and one reasons why inside my program. And when you understand the why, you can be empowered to make the change. So really understanding that your body's not broken. You are not destined down a path that's already pre-prescribed for you.
Mhm.
But it is going to require stepping outside your comfort zone and I don't know a way to be healthy without you actually understanding your body. So I'm a huge advocate for that education plus action and getting that data to drive a plan for women. And that's where I see incredible changes with my clients. And you can see all kinds of testimonials on my page
Hmm.
of the things they.
Yeah. I just wanted to say, it just occurred to me that I think maybe part of the issue with like waiting for everything to fall apart is maybe shame of not being able to know everything, not knowing who to ask, not knowing where to go, not knowing who to trust. I think that's really a big problem right now with, especially with the online culture where nobody really knows if I can trust anybody anymore.
Yeah.
And then figuring that you're just going to do it yourself. But you could end up in a situation where you're experimenting a lot for a long period of time and maybe you're maybe not getting results. So spending a lot of money on supplements, for example, that don't actually do anything. Whereas if you can find someone like, I've now connected with, I don't know, like 14 other speakers that are in the school of perimenopause, and more than that, I found resources this week from a talk that I did in 2022, that I published on the School of Perimenopause for everybody. But going and asking people who they might recommend if you have specific things that you want to address, right? Like, because if you don't really know anything or you don't have faith in your ability to move or you're not really sure how to get started with exercise, I would be a person to talk to about that, or sleep, right? I have a sleep program that could be very helpful. But what I'm saying is that this is why we're talking about the root cause. You can do a lot of things and that's not bad or wrong, but you do have to do things, like it does have to be layered in a certain way
100%.
for
Yeah.
you to get to that optimal state, right?
Definitely. And I don't think I even mentioned, but I'm Ninu Lammens. Nice
Hi,
to meet
Nina.
you.
I think
And
I said Nino at the beginning,
oh, you
so
did? Okay. And
yeah.
my business is Women's High Vibe Health, and my website's womenshighvibehealth.com. And I see clients Canada wide. I'm based out of Foothills County near Okotoks, and I'm just moving back to Calgary in the fall, even though yeah, it's been great out here, but it's just too much driving with my crazy life.
Oh, yeah,
Again,
yeah.
mitigating those
Mhm.
stresses. And then I have a program called the Happy Gut Reset Program, and that's 6 months long where we test and address the root and educate you on the why and give you the exact steps so you can erase the overwhelm and the confusion and just follow a strategy like as though it's the only strategy there is. And you will see transformational progress on your
And you
health.
don't have to do it by yourself, right? Because you're meeting with
I
these.
work with them. Yeah, I
Yeah,
work one to one inside the program.
yeah.
So I'm literally strategically guiding every single step and figuring out where the roadblocks are and what you need to do to change. Like I've had women who they eat clean, no gluten, no dairy, and they exercise, and they come to the program, and then bam, they lose 13 pounds. Their gut microbiome was a mess, and it was driving their cortisol levels. And it's all these layers and learning to see things that are interconnected that you never really understood were. And so my goal is to educate a whole other generation of women where they then bring it to their families and their partner and we get healthier homes because we have to really be our own primary care provider. And outsourcing your health and waiting for someone to come and save you, it's just never going to happen.
Well,
So
they'll keep you alive, but they'll let you be sick until you're 80 or
yeah, no,
90.
primary care. So primary care is like the first, first basics versus emergency care. So acute care, for sure, we need the medical system. But chronic illness is where people are, their quality of life is impacted negatively. And when your quality of life goes down, then I don't know about you, but a series of 40% optimal days in a row is a pretty crappy way to live. Rather than having, 90% days and 100% days and 85 and living in this world where your body's predictable. You wake up with the same awesome energy. You have the same cognitive focus. Like I was in a conference yesterday with 6 hours, and the last speaker spoke for 2 hours straight, and I absorbed every single word of what she said. I didn't have brain fog. I didn't space out. I didn't label myself like with ADHD or any other things that people are labeling themselves with. And I thought about that this morning. I'm like, wow, I literally laser focused for 6 hours, and that last speaker spoke for 2 hours, and I really needed to pee, but I still stayed and absorbed every minute of it. And just to have a sharp brain and quick thinking, it's so underrated. Like we're talking about things like bloating and anxiety and stuff like that, but really your brain health is super important for you to feel like yourself and like you
In
can.
our group, it's brain fog was number one. Brain fog
Oh
comes
yeah,
up as
you're right.
number
Yeah,
one
it was the number
all
one
the
concern
time.
you said.
Yeah.
Yeah,
Yeah.
and so it's like I sometimes when I talk to women, I'm like, are they going to absorb what I'm saying? Because this brain fog kicking in.
Yeah, yeah. It could, but that's why it's nice to have everything put on the school and then people can watch it and you can go back and check out different parts or like rewind it if you want to, or it's not going anywhere. So I really appreciate meeting you. I can't remember, were you the one who recommended that I get a book called Signs?
Yes, I was.
I did get that book, and you're already a blessing in my life, Ninu.
Oh, this is
I
gonna make me cry.
I started reading that book in the last 2 days, and I was like, this is exactly what I needed. So, this is part of the holistic part of working with other women and getting to know people. And I'm excited to join your program. I'm actually, I was thinking about it and I was like, well, da 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 da. And I have a thing that I'm doing that will be done in about a month that I want to finish first so that I'm not like that's one thing that I see women doing like I'm going to do some of this and I'm going to do some of this and I'm going to do some of this and like you're just causing yourself a lot of overwhelm
Yeah,
and way too much
yeah,
and now you don't know what actually did help because you're adding everything in all at once.
yes.
So finish what I'm doing in about a month and then I'm going to start in with you because I think that like I said that's my final frontier. That's the only thing I haven't done.
Yeah, and so many times, like you, Jessica, so many women know so much, and we can be bombarded with so many messages, but knowing is very different than embodying and doing. So it's like, how do we embody this and become? You actually become a different person. And I've had women who write those exact words. So after the program, they write back and say, I'm a different woman than I was when I started this program. Like it's about really stepping into understanding yourself and seeing that you never were broken. You never were. You were just convinced that you were because maybe since you were little or you were a child or parent neglect or programming or spousal abuse, all kinds of stuff happens that make us feel, or even our doctors and gaslighting makes us
Hmm.
feel like we're just broken. I'm just different,
Yeah.
It's like you're not different. You're a beautiful human being that's perfectly made. We just need to remove those roadblocks and put yourself back into optimal because you can thrive and you really do deserve it. And there's so much information out there, but don't let that stop you from taking the biggest first step, which is just saying yes. Just being like, I'm going to do this thing and just be guided every step of the way. And that's why I work with women in the capacity I do, because I'm not going to go and see somebody for one 60-minute session and change their life. Like that would be ludicrous. So
No.
I have developed it where it's over a period of time where I see women 3 times. They contact me via email for over 6 months, and then they get the testing and they get the education over 40 hours of content, but it's all strategic. It's all, I need you to watch this and go get this from Superstore and start having that right away. I need you to, it's like real life. Like, I need you to look here, do that right now. Do you get, and they understand the why. And then it's like week 2, and we're going layer by layer from gut to digestion to nervous system to liver to lymphatic system to sleep to minerals and to hormones. So we're going in the strategic order that the body requires to heal. So I reverse engineered my own healing. And when I used to work one to one with women solely without the program, I reverse engineered all the results that we got and said, what did we really do to get here? And then I created the program out of that. It's born of a proven protocol and proven process. And yeah, I just love what I do and I'm so passionate about it. But thank you for having me. It's been an honor.
Yeah, it's been really great. And we'll keep in touch and I will send you the link when it's up. It's got a
You bet.
process on Zoom and all that good stuff. And then you are in our group, right? You're in the CPMS group. I
Is
believe
that the
you are.
Facebook one?
Yeah, the
Yes.
Facebook group. So
Yeah,
you
I am.
can, so if people have questions, this video will be sitting there and they can send you messages or ask you questions or go check out your website. And I would highly recommend that you do so, especially if you're one of those ladies who've done this and this and this and gotten like a little bit of help and it helped a little bit, but there's something missing that
Yeah.
this could potentially be what it is. And you'll never regret, I think you'll never regret looking and helping yourself in the area of your gut health, I think.
100%. I've never had anyone regret doing the program. So,
Yeah. Perfect.
but I do
Awesome.
have free 30-minute calls if anyone is like, I want to share my story and see if make sure this is the right investment for me because it's not cheap. And so if you want to be doubly sure and speak to me one to one so I can confirm that you're the right fit, then you can book a call with me. The call link is on my website, or you can email me hello@womenshighvibehealth.com and I will be happy to book you in for that. I don't have a lot of space in my calendar every week for that, but I can usually make it work with your schedule at some point.
Yeah, and she might recommend a great book to you then.
That will
So,
change your life.
okay. Awesome. We'll
Amazing.
talk
This has been
again
so.
soon.
Okay,
Have
have
a
a great
great
weekend.
day.
Bye. Bye,
Bye.
everybody.